I know I have John Smith. He came in with vertigo, not yet diagnosed. So I'm looking around, looking for isolation precautions, no isolation precautions. If I'm looking at my patient general survey, I see that my patient is alert and orientated. There is no distress, and they seem pretty cooperative and comfortable in the bed. So I'm washing my hands, I'm ensuring privacy, I'm walking into my patient's room. So hi, Mr. Smith. My name is Nicole. I'll be your nurse for today. What brings you in today? What's the issue? Oh, sorry, vertigo. Okay, and okay, so that's great. So now I'm looking to make sure patient identity. So can you tell me your first and your last name and your date of birth as I compare with my patient's bracelet, and I can also compare with my patient's chart. So because you're coming in today with a bit of spinning, what I'm going to do is actually a cardiovascular assessment. So I'm going to be asking you a few questions. I'm going to be assessing a few of your pulses as well, and auscultating your chest or your heart. Okay, it should take about 10 minutes or so. At the same time, I'm going to be putting some stuff down, and all of that information will be in your chart for confidentiality purposes. Okay, so no one else will have access to that information. Okay. And do I have your consent to start?
Yes.
And any questions?
No.
Okay. So in terms of some questions, I can ask, are you short of breath? Are you having any chest pain or chest pressure? Any personal cardiac history or family history of cardiac diseases? I can also ask about personal habits. So are you a smoker? Have you been a smoker previously? I can ask, what's your diet like? How is your exercising habits like? I think I've hit enough of them. So in terms of the vertigo, I'll start with my OPQRSTU. So when did the vertigo start, or when did the spinning start? What makes it worse? What makes it better? Can you describe to me the spinning? Can you tell me where the spinning is originating from? So is it your head? If yes, where is it? And how is it affecting you? Are you having trouble seeing? Trouble with your balance? Where am I? Oh, severity. So in terms of severity, so on 0 being no spinning at all to 10 being the worst spinning, how would you rate this vertigo or this spinning? Does it come and go? How long does it last? And what do you think might be the cause of the spinning? Okay, so now I've taken my patient's vital signs. So I'm looking at them. So I see that my patient has normal vital signs, actually. They're all within normal range, except that they're hypotensive at 88/60. And so normal range would be anywhere between, depending on the patient, about 90 to 129. And then diastolic would be between 70 and 89. Okay. Okay. So on inspection, I'm starting my cardiovascular assessment. On inspection, I see that my patient is non-diaphoretic. They're alert and orientated. They're maintaining eye contact. They're cooperative for my behavior. In terms of color, they have even color throughout. So there's no cyanosis or pallor seen in the extremities, whether it's in the feet, in the hands, or mucous membranes. And for pulsation, it's hard to see whether or not there is a pulsation. But if I'm looking on an angle, looking for a lift or a heave, there's no lift or heaves. I'm going to be checking for pulse points. So I would be doing this bilaterally, but for the sake of this critique, I'm just going to do it on one side. So I'm going to start with the carotid. So this checking for strength and regularity. So this one is a 2+. I will do radial next. Good. So 2+. Coming over to dorsalis pedis. So over here. You need to have your shoes off for this. Socks, better, but definitely shoes. So 2+ for dorsalis pedis, and then posterior tibial. I can feel them, but they're not that strong. A1+. Okay. I'm also going to check for cap refill, so I'll just borrow your hand for a second. Here, checking, making sure that it blanches and counting the color for it to come back, how many seconds it takes for it to come back. So it came back within 2 seconds, which is a normal cap refill time. Doing the other hand, and that also came back within 2 seconds. Okay, so now I will be auscultating for heart sounds, your lub-dub, any abnormal heart sounds as well. So starting with the diaphragm, so I'm starting on the right side, so identifying the suprasternal notch, the sternal angle, and then going into the second intercostal space. So second intercostal space, right sternal border, the aortic valve, S2 sounds here are loudest. Going into sternal angle, the next one. So second intercostal space, left sternal border, pulmonic valve, S2 sounds are loudest. Moving on, third intercostal space, left sternal border, this is Erb's point, heart sounds are equal. Moving along. Okay, hold on. Let's repeat that. Aortic, pulmonic, Erb's. Tricuspid would be here. So this is my fourth intercostal space, left sternal border, and tricuspid valve. S1 sounds are the loudest. And now for my mitral, do you mind just, thank you. So here, mid-clavicular, we're going at the fifth intercostal space. Fifth intercostal space, mid-clavicular line, this is my mitral valve. It is also my apical pulse, so this is where I would also auscultate for that. I would auscultate for an apical pulse if I had an irregular rhythm or if there was a pulse deficit. I'm going to repeat that process now with the bell, listening for low-pitched murmurs or extra heart sounds. Okay. And over here. And so no murmurs, no extra heart sounds. And if I were to hear